You're welcome at Medical Sciences. In this session, we want to discuss about the grossing and reception of the sample in histology lab. So we're going to see how the first thing we are going to introduce is the workflow of the tissue in the histology lab or in histopathology lab. Then we shall see in this session, we shall discuss reception, tissue reception, and tissue grossing. Then the others, we shall keep on discussing them in the coming videos. And we normally urge you to subscribe. That is the only support you can give us, by subscribing if you haven't and liking the video. So we want to look at histology, and you can ask yourself, what is histology or histopathology? Histology is the study of tissue. Then histopathology, we say the study of disorders of the tissue, or what we call cancerous tissues throughout cancers and tumors. So we want to see how do we process a sample for examination throughout any abnormality in the tissue for diagnosis of different diseases. So the workflow of this is you begin with specimen collection, and specimen collection is done by surgeons or doctors. It is done by doctors or surgeons. So here, the laboratory people do not participate in specimen collection in histopathology lab. After the specimen has been collected, they should be fixed. Here we use the different fixatives, as we shall discuss in the series of videos, whereby the most commonly used fixative is formalin, 10% formalin. And why do we fix immediately? We want to make sure this tissue which has been collected to remain in its lifelike state, or to prevent damage, either by autolysis, that is by lysosome enzymes in the tissue, or putrefaction, whereby it is by bacterial action on the tissue. So we want to make sure the tissue remains in its lifelike state by fixing it in formalin. And after fixation, this formalin should be at least 10 times. At least 10 times more than the sample or the specimen. So formalin should be at least 10 times more than the sample which you are fixing in. And after fixing this sample, the doctors from the surgery room or from the theater, they bring this tissue and they are received in the laboratory. So reception is that they are received in the lab. So after being received in the lab by either a histopathologist or a cytologist, they are received, and after being received, we enter them, as we are going to see in details under reception. We are going to discuss it. We can receive or reject. We shall see reception criteria and rejection criteria. And after being received and they are matching with the information on the request form, then we start grossing, whereby under grossing, we can call it grossing or cut-up section, whereby the major aim of grossing is to make tissues, small tissues, for easy tissue processing. So you have received a big tissue like this, which is a blessed mass, and you cannot put it in a tissue cassette like this. These are some of the samples of the tissue cassette, and this tissue cassette cannot hold the big sample received in histology. So what we do under grossing is we are making these tissues small, in small sizes, cutting them in small sizes for easy tissue processing. So after grossing has been done, we now go into what we call, for hard tissues only, we do what we call decalcification. Decalcification is we are removing calcium ions from a hard sample like a teeth, any hard sample like bones, to make them soft for cutting and tissue processing. And this one applies only to the hard tissues or calcified tissues like teeth and bones. So it is not for all. Then after grossing and decalcification for hard tissues, for soft tissues, we go directly to tissue processing. This is for soft tissues. And tissue processing, we are using a mnemonic FDCI, whereby the first thing is fixation. You do fixation, you do dehydration, then we do clearing and impregnation. You can call it impregnation or you can call it infiltration, whereby you are placing the clearing agent with melted or molten paraffin wax to replace it so that it renders the tissue rigid or firm for easy cutting. So the processes we shall see, in case the tissue is not well fixed, we can fix it further under tissue processing. Then we dehydrate using increasing changes of alcohol. We clear using either xylene or taurine. Then we impregnate by giving paraffin wax. Then after tissue processing, we go to what we call embedding. And under embedding, here we are. Embedding is, we get a tissue mold whereby we are providing a solid medium by using paraffin wax, whereby we orient the tissue in the mold. This is the mold where and there are different sizes of the mold and types, whereby we add a molten paraffin wax, then we orient the tissue in the mold, and we add more paraffin wax, and then we cool so that it provides a media for easy cutting. That is what we call embedding, tissue embedding using molds. And after embedding the tissue to provide firm attachment, like for example, if I can, this is a tissue cassette where it is already embedded with paraffin wax, whereby it has provided a firm media that during cutting by microtomy, we can easily cut to provide tissue sections for staining. And after embedding, here we are going to be using majorly paraffin wax as the embedding media together with molds. Molds can be metallic, can be plastic, can be whatever. Then after we shall see cutting or section cutting, which we call microtomy, whereby under microtomy we shall see using microtomy machines with microtomy knives. And these microtomy knives are the one that will be able to enable us to cut sections between 3 to 5 micrometer or microns. So after cutting these sections, because when the tissue is embedded, then we expose it to the microtomy with a microtomy knife, and we begin cutting small sections on the tissue which we embedded. And after getting small sections, they are put in a frotting. They are frotted. And how do we frot out? Under frotting out section, here we are using water bath. We normally use water bath. And this water bath is always put at a high temperatures between 60 degrees centigrade or between 40 to 60. And this frotting out is to straighten. Remember, when you're cutting the sections, they fold, they make some foldings. So we are putting it in a warm water bath so that it straightens the cut up section so that it can easily be mounted on the slide. And after frotting out in a water bath, we now do what we call stain. We mount on the slide and we stain either using H&E, that is hematoxylin and eosin, or we can stain using special stains, or we can even perform IHC, that is immunohistochemistry, on this by staining using IHSI, immunohistochemistry technique. Then after staining, we examine the tissue microscopically. Here we examine the tissue microscopically, and majorly examination is done by histopathologists or by a pathologist, not lab technicians. That is, so for us, our role is to prepare the tissue, then examination is by the pathologists. But so after seeing this workflow of the tissue after being received for histopathological purposes, whereby we have seen specimen collection, fixation, reception, grossing, and we have said for hard tissues they can be decalcified. Then soft tissues go directly under tissue processing, where we have used the mnemonic FDCI, whereby it is fixation, dehydration, clearing, and impregnation, which we shall discuss in details. Then we have seen embedding, that is providing a solid media for microtomy. Then microtomy is whereby we are cutting small sections, 3 to 5 microns, which are floated out to straighten them, to remove their folds, and then mounted on the slide for staining, and after staining we examine. So after looking into that, in our series of videos, we are going to be handling each step in details. And in today's session, we want to start with the reception of a tissue sample. After the doctor or surgeons have collected this tissue, they have pressed it in a formalin, in a fixative like formalin. How do we receive it in the laboratory, in a histopathology lab? And the first thing we do under tissue reception is we register the tissue. The first thing, you register the tissue. You put the tissue in the register. You register with the information provided on the tissue. After registering the tissue, you register and accession the number. You give it a lab number, a lab ID number, because each tissue should be assigned with a lab number, ID number. And after putting the information of the specimen in the register, assigning it with the lab ID number, then you start by matching. You match the information. You match the information on the tissue container. Tissue containers must be labeled. So you match the information on the tissue container with the one on the request form. With the information on the request form. What are that information we are looking at? We are looking at the name of the patient. Name of the patient. We look at the name of the doctor who have requested, name of the doctor. We look at the description. This request form should be having the description of the site where they have cut the tissue specimen, and even should be labeled, should be with markers, surgical markers. These markers, we call them surgical. Should be with the surgical markers describing the position of the sample. Is it inferior position, posterior, and whatever. So look for the markers, the description, and you should also look at so under the description, that's where we find much of the information, whereby what the doctor is suspecting and what he's interested in. So after finding that they are matching, the information, the tissue container and the request form, they are matching, then you accept, or you accept the specimen, and we start the processing position. But in case they are not matching, then we reject the specimen. When do we reject the specimen? When you have received the specimen which is not fixed, which is not in the fixative, that one we can reject it, because we can have changes which have occurred. And in case the information on the request form is not matching with the information on the container, it is still rejected. If there is no description of the tissue, it is also rejected. The doctor must provide the description of the tissue and the location where it was cited. Then also the name of the doctor and the ward is very important. where they have picked the sample. So in case that information is lacking, we reject the histopathology sample or the tissue. And this is what we can discuss in details under reception, tissue reception. After we have received the sample and it has passed the acceptance or criteria, we now do what we call fixation, but fixation is already done before it reaches in the lab. So our role is to see if the sample was fixed well, and if it was not fixed well, we add more of the fixative. And after that, we go to grossing. Here I told you under grossing or cut up, here we are getting a big mass and we are cutting it into smaller sections to enable easy tissue processing. And here under grossing, we use different materials like weighing scale. We shall use weighing scale. We shall use blades, sharp blades. We shall use saw. We shall use knives, sharp knives. We shall use rulers to define the dimensions. We shall need a chopping board. We shall need a chopping board and many other things we might require. And even we shall need a tissue cassette where we shall be placing our cut sections from the mother specimen. So in the grossing, as we are cutting, the first thing we do is we do macroscopy. We do what we call macroscopy. And under macroscopy, we determine the weight of the tissue. And after getting the weight, that is using a weighing scale, we also define the dimensions, whereby we measure the height, the length, and the width of the specimen using a ruler. Then after that, we also do what we call define the features, the peculiar features on the sample. In case of presence of hair, we record it. Presence of ulcerations on the sample, we also record it and their location. That is before cutting. Then we also have to define the location of the tumor. We define the location of the tumor because sometimes they cut a big specimen and the tumor is maybe located in this position. So we have to define the location of this. Maybe the doctor has said the tumor is in this quadrant and this is the tumor we are interested in. So the first thing we do, we sample from all points. After microscopy description and the location, we have to get our knife, if it is simple, or the saw. We begin sampling in each quadrant. We sample. If this is the posterior, this is the posterior view of the sample. This is the anterior, because the nipple is in anterior position. This is posterior. This is inferior position, and this is superior position, and this is maybe medial. So after describing the locations where you want to sample, you sample as you put in the tissue cassette, and afterwards you also, maybe this is the inner upper quadrant, this is the inner lower quadrant, and this is maybe the outer upper quadrant and the outer lower quadrant. So here we are trying to describe the location, and we shall find the location of the tumor is in the outer lower quadrant of our tissue. And we are taking an example if this tissue was a breast tissue. If it is a breast tissue, we are using that example, whereby you define the location, the anterior position, the posterior, the superior, and the inferior. Then you go ahead to make the quadrants to define which position is the tumor located. And we find the tumor is also located on the outer lower quadrant. You also report it under the description. And then you also sample in specific areas like the nipple. The nipple should be sampled, and the lymph nodes of the breast. If the lymph nodes are found in the posterior position, you also sample the lymph nodes to see if maybe the tumor has metastasized. So that is what we do under grossing. And after describing, as we are cutting different sections, we keep cutting sections as we place them in the tissue cassette. So this tissue cassette, you sample the sections you cut in the outer quadrant, you put a tissue, you cut in the outer, you sample the nipple, you sample in the lymph nodes position, and even you sample where the tumor is located. Then you put different sections cut in this tissue cassette and you cross. Then it is ready for tissue processing. So this is what we can discuss under tissue grossing of the tissue. Thank you so much for following or for learning with us at the Medical Sciences, and we are always privileged to have you here. Thank you so much.